It seems to me that we're doing a great disservice when we do that. I was in Washington, D.C. a few months ago, and I was talking to several legislators there, Democrat and Republican alike, House of Representatives and senators. I spent a couple of days in meetings. One of the questions I asked was, why and how do you decide what subsidies to do? You do subsidies for farmers. You do subsidies for certain industries. And they said, well, we subsidize those things that we want to continue, that we want to flourish. That's what we subsidize. I thought, well, that makes sense. So if you have a drought, for example, in Kansas or Nebraska, so you want to have wheat farmers and corn farmers, so you subsidize them to help them through the rough times. You do whatever because you want to have those farmers, so you subsidize them. So, okay, makes sense to me. We subsidize those things we want to continue. We don't subsidize things we don't. I look at what's happening in what you're describing in San Francisco and what I see in a lot of these progressive cities, and it seems like we're subsidizing drug addiction.
100%. It's definitely, we're subsidizing addiction when we should be subsidizing recovery from addiction and recovery from mental illness. One example I think is important to remember is that when we were worried about the deaths and disease from cigarette smoking, we ran campaigns urging people to stop smoking cigarettes. In San Francisco, the city government has run advertising campaigns, and I kid you not, people that don't believe me because it's so shocking can Google this. They ran ads encouraging people to snort or smoke heroin rather than inject it because they thought that that would reduce the likelihood of overdose. That's a kind of campaign that would be trying to reduce some of the diseases associated with cigarette smoking, when in fact, in the case of cigarette smoking, we went right at the root cause, which was addiction. We stigmatized tobacco addiction in the United States, and it was extremely effective. Sometimes people went too far, and some smokers felt stigmatized personally. But for the most part, we understood that this was a bad habit, that it was better for people to quit, and the society had a public interest in encouraging people to quit. That's not what we're doing with heroin, cocaine, methamphetamine, fentanyl, and other hard drugs in places like San Francisco, but also New York. We're encouraging what we call the safe use. Well, there is no safe use of these drugs. These drugs ruin lives. They are highly intoxicating and highly addictive. So we've created a double standard because we have come to convince ourselves, progressives have come to convince themselves, that the people that are addicted to these drugs are actually victims of societal oppression and trauma. And in that sense, they've put them in a different category of the people who smoke cigarettes.
Explain to me what your understanding of that position is. And I'll preface that by saying addiction, in my view, is a serious disease. It is resistant to treatment, it is subject to relapse, and it is potentially fatal. So there is no safe use of these drugs. You are subject to killing yourself each and every time you use the drug, particularly if you're getting the drug on the street, because you don't know what you're getting. You know, if it's got battery acid in it, you don't know if it's laced with fentanyl. And I understand they say in these safe sites, they have a laser they can use to check for fentanyl and all, but that's every time they use it there. That's not every time they use it. That's naive to think that by allowing this habit to continue, this is a medical disease. I'm not judging the individual for having the disease. What I don't understand is how they are in a different category of being oppressed and therefore are held to a lesser standard. What is that argument?
Right. So the argument, and it really comes out of the 1960s again, where people with mental illness first were viewed as victims of society. This was a very fashionable idea in the 40s and 50s. There was actually a broad movement to deny that mental illness, serious mental illness, I mean, by serious mental illness, I'm distinguishing between, schizophrenia, bipolar disorder, severe depression, not the ordinary ups and downs that everybody has. And there was an effort to deny that and to say that it was a result, first of childhood upbringing, but then increasingly more radical progressive types said it was a result of society injustice. So that was where it first came from. It was then applied to addicts around the time of harm reduction in the 1980s and 1990s. And the fact is that people that are suffering from drug addiction do tend to have higher rates of childhood trauma and abuse. There's comorbidities, including dual diagnosis with mental illness. But that doesn't then say that you should not require people to take responsibility or that you should enable those disorders from continuing. But it does come from a pretty rigid view that you can categorize people into victims or oppressors, and to victims, everything should be given and nothing required.
Let's assume that's all true, just hypothetically. I don't believe that. I don't think you believe that. But let's say, for argument's sake, that we buy off on all of that. Where is the corridor to regaining mental, emotional, social, spiritual balance and becoming a self-determinative, contributing member of society?
Well, what the advocates of this radical harm reduction approach say when you push them on that question is they say, well, the data show that if you give people needles and you have a positive social interaction with them, then they're more likely on their own to decide to quit doing drugs on their own. But that is actually not the case, by the way, of what the data show. The data show that exactly what you've been saying, which is that when you enable, when you coddle, you reduce the incentive for people to quit. We know that there's a whole branch, the most effective branch of addiction recovery is something called contingency management, which is providing people with rewards for recovery, for abstinence, whether that's a gift certificate or praise or housing. And so one of the most famous examples in Birmingham, Alabama, homeless crack addicts who were in homeless shelters, if they pass a drug test, they would get access to housing. If they fail the drug test, they go back to the shelter, not to the street, but to shelter. And that incentive provided them with a way out. Whereas what we've seen in San Francisco and in California is a severe increase in street homelessness, street addiction, as a consequence of really 20 years of reducing the consequences for destructive behaviors.